I'd like to welcome you to the upper limb, and I'd also like to welcome you to our model when we look at a Nora fault. We'll be looking at the shoulder to begin with, and we'll be looking at ligamentous stress testing, followed by stability testing, and then mobility testing, and we'll take it up into treatment thereafter. Okay, we'll look at ligamentous stress testing first, and the ligaments we'll be testing around the glenohumeral joint will be the glenohumeral ligaments, the coracohumeral ligaments, both the anterior and the posterior band, and the transverse ligament for the biceps tendon. So, beginning with the glenohumeral ligaments, these are anterior ligaments that are fairly superior on the anterior aspect of the shoulder joint. They form in three bands, and we'll be testing them with lateral rotation and extension, and either abduction for the inferior middle bands or adduction for the superior band. And the stress will be an anterior shear. So we'll get Nora to move towards the edge of the bed so that I can drop the arm over. Now, it's important when you're stress testing to take the joint to its extreme of range before you apply the stress. So looking at the superior part of the glenohumeral ligament first, we'll take her into adduction. Now, if you put your arm over the top of her wrist, then you can control the lateral rotation just by leaning back like so. Bring it into extension in that position, and then stabilize the clavicle and the coracoid process by pushing down it, and simply shear the humerus forwards. On a bigger patient, you can avoid the stabilization and simply pull up with both hands. Now, what you can see is it takes three hands to do this technique. So you need the two hands and your body. And I've got a leg, or arm trapped, that you can see when you come a little bit closer. You can see that her arm is actually caught between my thigh here and the bed. So I can ab and adduct this to where I need it. For the inferior band and the middle band, we'll do basically the same test, but this time at about 90 degrees of abduction. So again, full extension and about 90 degrees of abduction, full lateral rotation, stabilize in the same manner, and shear ventrally. And again, if on a bigger patient, you can use both hands to do the shear. So this is really a technique where you have to use your body, considerably so. And this is where you're going to control the abduction and the extension. Okay, having